Before you get a rhinoplasty, there's a few things you should understand that patients don't hear during a standard consultation or see in a before and after photo. Your skin thickness matters. Swelling can last much longer than expected. The nose may heal unevenly at first, and the result is shaped not only by what you want, but what your anatomy can realistically support. My name is Dr. Colin Pero. I'm a facial plastic surgeon in Dallas, Texas. I specialize in rhinoplasty and facial cosmetic surgery. In this video, I'm going to walk you through 10 important facts that you need to know before undergoing rhinoplasty, so you can go into the process with better questions, better expectations, and an understanding of what it takes to achieve a successful result. The patients who are best prepared for rhinoplasty are not the ones that know the most medical terminology. It's the ones that best understand what it takes to achieve a successful result. Number one, inspiration photos are not a blueprint. Are celebrity photos and inspiration photos helpful during a consultation? Inspiration photos can be helpful because they often show a patient's preferred aesthetic results. They may show me that the patient prefers a straighter profile, a more refined tip, more rotation, more projection, less projection, etc. An inspiration photo should inspire a conversation. It shouldn't be an exact blueprint for the final result. The inspiration photos sometimes will indicate a patient's preference for maybe a more stylistic nose or more natural appearance, but it helps initiate that conversation and really helps translate what the patient's trying to explain to me. And so then I can show them with the computer imaging how I think that would look on their face. It's important to realize with inspiration photos that this is a nose that's on somebody else's face. And so how the other aspects of that person's face interact with their nose affects how the overall balance looks. And so you can't expect to take a nose off anybody else's face and put it on your own and achieve the same result. A nose does not live by itself. It has to fit with the eyes, chin, forehead, lips, and the rest of the face. Bring inspiration, but don't expect duplication. The goal is to create a nose that belongs on your face. Number two, skin thickness influences the result. How does skin thickness affect a rhinoplasty result? The surgeon primarily reshapes the underlying framework of the nose. After that, the skin has to reshape over that framework. With thin skin, it settles very nicely over the nose, but it can show any minor irregularity. With thicker skin, it's harder to achieve as much refinement, but it also camouflages minor asymmetries or irregularities. Thin skin tends to heal faster with a closer to final results sooner than thicker skin. With patients with thicker skin, it's harder to achieve as much tip refinement as it is with patients with thinner skin. Therefore, in thin skin patients versus thicker skin patients, we may need to balance some of the overall profile of the nose to achieve more refinement in thicker skin patients compared to thinner skin patients. So there's really not a good skin or a bad skin for rhinoplasty. They're just different, like all things in life, right? So if you have thicker skin, it's probably going to be harder to see irregularities, but it's also going to be harder to achieve a lot of refinement. In thinner skin patients, you may have so much refinement that you can see every minor irregularity. So you have to balance that, and the rhinoplasty surgeon should help educate you about this process because there are actually some techniques that you can use in both thin skin and thicker skin patients to minimize the downsides. Think of the skin as a material covering a sculpture. A thin covering shows every detail underneath, while a thicker covering softens all those details. The surgeon reshapes the framework, but the skin determines how clearly that framework is displayed. Number three, there is no universally perfect nose. What actually makes a rhinoplasty result look natural? There's no single nose that looks perfect on everybody's face. A nose that looks good on one person's face may look completely unnatural on somebody else's. What determines the appearance of a nose on someone's face being attractive versus unattractive really depends on the other facial features involved. A patient's skin thickness, age, ethnicity, skin tone, all of these things may affect what makes a nose look appropriate for them and natural versus on someone else. A lot of patients come in asking for smaller noses, and sometimes that's appropriate, but sometimes it's not. Proportion is really the key. Sometimes a smaller nose fits on someone else's face, whereas on somebody else, enlarging the nose in some aspects, not all aspects, may actually better balance their overall facial appearance. Ideally, a successful result is not one that makes all of your patients look the same. They should be individually tailored based on all these other factors, your ethnicity, the appearance of your other facial features, etc. I like to think that patients should be recognizable after surgery. They shouldn't look like a completely different person. They should look like a better version of themselves. A natural result should look like it has always belonged on your face. The perfect nose doesn't exist. What matters is finding the perfect balance that fits on your face. Number four, appearance and breathing are connected. Why does breathing matter if someone's primarily interested in cosmetic rhinoplasty? The nose is a very unique structure. You have skin, cartilage and bone, and then mucous membrane on the lining of the nose. And those structures are very close to each other. So it's hard to impact one externally without impacting things internally. So patients that come in primarily interested in cosmetic rhinoplasty don't realize that sometimes the things they're asking for may negatively affect their breathing. Many patients present with anatomic problems inside their nose that may affect their airway already. Sometimes patients have grown up with this. It actually can worsen during adolescence, and so they just think that everyone breathes like this through their nose, and they don't realize that they could breathe significantly better. Addressing the airway at the same time as performing the cosmetic changes is essential to prevent long-term problems with your nose. I can guarantee you that if you can't breathe through a nose that looks great, you're not going to be happy. During your consultation, you should make sure that the surgeon is talking to you about both the external features, but also the internal features that they see during an inspection of your nose. The plan should always include improvement or preservation of nasal breathing. And a cosmetically attractive nose that doesn't breathe well is not a successful result. The outside and the inside of the nose are connected. You cannot change one without considering the other. The nose should not only look good in photographs, it should function well throughout your life. Number 5, open versus closed rhinoplasty is not a contest. Is open or closed rhinoplasty better? In a closed rhinoplasty, the incisions are all placed inside the nostrils. In an external or open approach to rhinoplasty, usually there's an incision made in the columella, which is the strip of skin between the nostrils. When done properly, the scar should be minimally noticeable, if not completely invisible. There are pros and cons to both approaches. With an endonasal or closed approach, usually this is addressing minor irregularities and minor refinements. With an open approach, it's a more powerful technique to tackle tougher problems like significant irregularities, asymmetries, previous trauma, significantly asymmetric nostrils, etc. So it's really not just a question of which one's better, it's which one's better for you, depending on your problems and your goals. What's more important than the approach, open versus closed, is the surgeon's expertise in using one or the other techniques to address your particular problem. So the approach is just a way to assess the underlying anatomy. It's not an indication of a successful or better result. The better approach is the one that gives your surgeon complete access to address the problems that you wish to address and achieve the goals that you set out for together. Number 6, surgeons don't simply break your nose. Do surgeons actually break the nose during rhinoplasty? So during rhinoplasty, there are many different structures that we address. The tip cartilages, the middle vault or upper cartilages, and then the nasal bones, in addition to underlying structures such as the septum. Now, if there's an irregularity to the nasal bones, there are different options on how to address that. If there is a significant asymmetry, where one nasal bone is significantly shaped differently than the other, then yes, the nasal bones will need to be addressed to correct that. Most modern surgeons doing rhinoplasty surgery do not use techniques where we break the nose. In my practice, I'm using a piezotomy to very carefully make accurate cuts in the bones so we can manipulate them into the proper position. This is not an uncontrolled fracture. It's a carefully planned manipulation of the nasal bones. We're not randomly breaking the bone. We're making very planned, controlled, deliberate adjustments to the bones. Number 7. The cast removal is not your final reveal. What should patients expect when the cast comes off? Although it's an exciting day, the day that the cast comes off does not indicate necessarily your final result. I tell patients I'm going to start talking to them about what their nose looks like at a month. And I said start. So we begin talking about the final result at a month, but it takes a year before it completely resolves. So the funny joke I make with a lot of my patients is if you're going to be in a wedding, do this a month beforehand. But if it's your wedding, do it 3 months beforehand. You get the point. We don't take pictures until 3 months in my practice, but we take them at 6, 9, and 12 months as well. Why would I take pictures of the same nose over and over again? It must keep changing. There's a lot of subtle refinements and shadowing that happen over that time period that change the overall effect of the nose. So you're going to think you look pretty good at a month, 3 months, but then you'll get to a year and realize that you weren't anywhere close to done. Different things can affect the amount of time for the swelling to go down. Typically, it's kind of gravity based. So at the top, the swelling goes down faster, but at the tip, it takes a little bit longer. And that's worsened by patients with thicker skin or eating a lot of salt, especially early on in the recovery period. The nose you see when the cast comes off reflects the beginning of the healing process. It's not a finished product. So the cast removal reflects the beginning of the result, not the final result. Number 8, revision rhinoplasty is possible, but it's more complex. What should patients understand about the possibility of revision rhinoplasty? So a famous rhinoplasty surgeon once said that you could justify a rhinoplasty on just about anybody. So a lot of this just comes down to preference, right? And so revision rhinoplasty is most commonly done because the patient prefers a different result, not because there was a major problem. Although that does occur sometimes, especially when it comes to breathing or significant asymmetries. A lot of the times revision rhinoplasty is done to get patients a little bit better than where they ended up. It's impossible to guarantee an outcome. No ethical rhinoplasty surgeon will guarantee you an outcome. If someone tells you you're going to have a perfect nose, it's time to leave their office. Each revision of a rhinoplasty gets more difficult. There's more scar tissue, more of the original structures have been altered, and so it's harder to predict, number one, what's left over inside the nose and in what configuration, but also how it's going to heal afterwards. Some revisions are small, just to alter some minor irregularities or to change maybe a preference on a result, but some are more substantial and require kind of taking the nose apart and starting all over again. The first surgery is obviously the easiest opportunity to get a good result, and so it's best to feel that you're with a surgeon that understands your goals and can deliver based on your particular anatomy and your concerns. Surgery is performed by the surgeon, obviously, but the healing process takes place within the patient's own body. The first rhinoplasty begins with untouched anatomy. Revision rhinoplasty starts with anatomy that's already been altered and is less predictable as far as what can be expected underneath the surface and how it's going to heal. Number 9, recovery is more often about congestion than severe pain. What does rhinoplasty recovery actually feel like? A lot of patients expect the recovery from rhinoplasty to be extremely painful. I usually tell patients it's more annoying than it is excruciating. It's more like going through a severe cold where you're really annoyed that you're not normal, but it's not miserable. Usually the first day is not too bad, but swelling peaks at days 2 through 4. And so that's usually kind of the hardest part to get through. And primarily that's from a swelling standpoint, both internally, giving you nasal congestion, head pressure, etc. Because of the swelling internally, you may have some nasal blockage, which leads to some dry mouth. And yeah, that's really annoying for a couple of days, but it's not excruciating. Most patients do pretty well getting through that 2nd through 4th day. After the 4th day, it really is downhill. Patients do a lot better until we see them back typically on day 6 or 7 for the cast, split removal, etc. Now, I don't use any packing in the nose, so once the swelling goes down, the nose starts to open up again and patients can breathe pretty well through their nose by the time I see them back. It's usually less like recovering from a major injury and more like recovering from a head cold with nasal congestion, dry mouth, and some disruption to your sleep initially. Most patients prepare for significant pain postoperatively, but usually it's the nasal congestion and that feeling of inconvenience that's the primary feeling. Number 10, the emotional recovery is often overlooked. Why could rhinoplasty recovery be challenging emotionally, even when things are healing normally? The nose is central to the appearance of your face, so even a really good result can be unfamiliar to the patient and sometimes disconcerting at first. Patients can have some uncertainty during the recovery because there's swelling, there's temporary asymmetries, daily changes that fluctuate, sometimes a little better, sometimes a little worse. This can lead to patients taking multiple selfies, checking the mirror incessantly, asking friends and family about it, or keeping it to themselves. But sometimes they kind of lose touch of where they started and the overall trend of the recovery. And so while they're focused on moment to moment, they don't realize that day to day, week to week, the improvement that they're actually accomplishing. So patients sometimes may focus intensely on small changes. They may look at their preoperative imaging photographs from the surgeon and expect to look like that much earlier than the final result is realistic. Patients sometimes will compare themselves to either friends or family they know that have gone through the same process or online photographs and expect to be on a similar or even better timeline. And sometimes that's just unrealistic based on their anatomy, based on what was necessary during the surgery, skin thickness, etc. The key part really is to have good communication with your surgeon about your concerns. They should feel confident that they understand why things are happening like they are and that there isn't anything going wrong with your healing process. Talking to your surgeon is going to be much more helpful than talking to other people on social media, online forums, etc., because they know your nose intimately. They know what the steps were taken during the surgery to accomplish your agreed upon goals. And so be forthright in talking to your doctor on your follow-up visits about your concerns, because they should be able to address those and help allay your fears, because this is probably not the first time they've done this. They've seen lots and lots and lots of patients go through this process before and have the same psychological hurdles to overcome. You're watching the center of your face change gradually. So yeah, the tissues need time to heal, but your brain needs time to adjust to seeing that change happen gradually. So I think that preparing patients for the emotional side of recovery is just as important as the physical side. So rhinoplasty recovery requires patience, both with the appearance of your changing nose, but also the overall balance of your entire face. What are the 10 most important things a rhinoplasty patient should consider before undergoing surgery? Inspiration photos are helpful, but they're not a blueprint. They help communicate what you like, but the result must be adapted to your own face and your own anatomy. Number 2, skin thickness influences the result. It affects how much definition is visible, how the swelling behaves, and what can realistically be achieved. Number 3, there is no universal perfect nose. The goal is not to create the same nose on every patient, but one that looks balanced and natural on your face. Appearance and breathing are connected. Cosmetic changes must account for the internal airways so the nose functions as good as it looks. Number 5, open versus closed rhinoplasty is not a contest. Both approaches can achieve excellent results. The right approach depends on the patient's goals, patient's anatomy, and the surgeon's judgment. Number 6, surgeons do not simply break the nose. When bony work is necessary, it involves controlled, deliberate changes to the bony framework of the nose. Number 7, cast removal is not the final review. The nose is still swollen, it's still healing, and it's going to change and refine itself over many, many months. Number 8, revision rhinoplasty is possible, but it's more complex. Revision surgery is dealing with scar tissue, altered anatomy, and potentially loss of structural support. Number 9, recovery is often more about congestion than severe pain. Patients are often more affected by sinus pressure, nasal pressure, mouth breathing, dry mouth, and disrupted sleep after surgery. Number 10, the emotional recovery is often overlooked. Patients need patience while the nose heals, but also while seeing their face gradually change over time as the nose heals. Rhinoplasty is not just about choosing a new shape for your nose. It is about understanding your anatomy, protecting your breathing, and then having the patience to wait for the final result as things continue to heal. The more you understand about rhinoplasty, the less likely you are to misunderstand part of normal healing as a mistake or something going wrong. Rhinoplasty can be an incredibly rewarding procedure, but the best results usually begin long before surgery. With realistic expectations, a clear understanding of your anatomy, and a surgeon who's willing to explain both the possibilities and the limitations. The goal is not to create a perfect nose or someone else's nose. It is to create a nose that looks natural on your face, functions well, and continues to hold up over time. If you're considering rhinoplasty and would like to understand what's possible for you, you can visit us at drpero.com to schedule a consultation. Virtual consultations are available for patients outside the Dallas-Fort Worth area. And if you found this video helpful, please like the video, subscribe to the channel, and let me know in the comments which rhinoplasty topic you'd like me to explain next.